Welcome back to Bama Dermatology. Today I would like to talk about the immunohistochemistry, which is an important diagnostic tool in some diseases in dermatology. Well, immunofluorescence in dermatology can detect the antibody are bound to the antigen in circulating body fluids or tissues, which is an adjunct to clinical and the histopathological diagnosis, especially autoimmune vasculobullous disease and connective tissue disorders. So it can identify such as anti-nuclear antibody in the autoimmune connective tissue disease such as SLE, and autoantibodies of the autoimmune blistering diseases such as pemphigus vulgaris or bullous pemphigoid, and infiltration of the malignant lymphoma cells. So the methods used here are immunofluorescence and immunoenzyme methods. Here are the monoclonal antibodies that are frequently used in dermatology, such as here cytokeratin for epithelial cell marker, and this S100 protein and HNB45 melan A for diagnosis of malignant melanoma, and CEA for the steroid gland, or Ki67, which is a cell proliferation marker for the tumor cell and inflammatory disorders, and some specific cell markers such as CD3 for T cell and CD4, CD8 such as for helper T and cytotoxic T cells, CD20 for B cells, and etc. etc. And such are the important markers for the which will be positive in some skin component and the skin disorders. Here is the mechanism of the immunofluorescence techniques, which are the direct, indirect, and the complement immunofluorescence. And direct and indirect immunofluorescence are now mostly used in dermatology to detect the antigen-antibody reaction in the autoimmune blistering disease and connective tissue disorders. And the complement immunofluorescence is now obsolete, but here I added this immunofluorescence technique just a little bit understanding. So here, direct immunofluorescence is a single-step procedure that directly detects the fluorescent antigen-antibody reaction in the patient's skin and mucosa. So here, the patient's the antigen in the patient's skin or mucosa is detected by reaction with the label antigen-specific antibody, and it shows the fluorescent and under the immunofluorescence microscope. So indirect immunofluorescence is a two-step procedure that detects the fluorescence in the patient's serum, and the first step is the serial dilution of the patient's serum, which contains the antigen, and is incubated with the antigen-specific antibody in the tissue, and it then in the second step is detected with the specific the antibody labeled with fluorescent, and this leads to this fluorescent reaction, and can be observed under immunofluorescence microscope. And in the complement immunofluorescence is the unlabeled primary antibody is reacted against the target substance, and is provided with the complement component. Then is the labeled secondary antibody such as like an anti-C3 antibody is reacted against these target substance, which is a combination of antigen, antibody, and the complement substance. and leading to the immunofluorescence and observed at the immunofluorescence microscope. So these are the mechanisms. So here is the immunofluorescence pattern, which can be seen in direct immunofluorescence and the indirect immunofluorescence. In the direct immunofluorescence, which can detect the autoantibody in vivo, and mainly in the autoimmune diseases such as, like I mentioned before, autoimmune blistering disease and the lupus erythematosus, in which we need to take the patient's skin biopsy specimen from the perilesional skin in the autoimmune blistering disease and lesional or sun-exposed skin in the lupus erythematosus. And it can detect also like a pathogenic microbial organisms in the tissue. And so it directly detects the antigen from the tissue of the skin, so the sensitivity is higher, about 90 to 100% in the active diseases. So here, the immunostaining pattern, we can see like chicken wire appearance of the IgG and C3 in the bullous pemphigoid, like subepidermal blistering disease, and this pattern of like IgG autoantibody, IgG in the presence or absence of C3 it can be seen in the pemphigus vulgaris, and which is like a intercellular pattern in the cellular space. We can see the antibody fluorescent pattern in the intercellular space. So it's I mentioned before, like it's two-phase processes, and detect the antibody in the patient's blood. And in dermatology fee is we can detect the antibody in such kind of blistering disease, but in other fees it can detect the antibody and the syphilis antibodies tests using the normal skin as substrate. In the immunoenzyme method, not like the immunofluorescence methods, which use a fluorescent dye or antibody, but rather use an enzyme which can be labeled with the antibody, and the antigen and immunoglobulin and complements can be detected using the enzyme reaction. The enzyme used is peroxidase, which is labeled with the antibody to react against the target molecules in the tissues, in the same way like I mentioned before in immunofluorescence techniques. And the presence or absence of the target substance is indicated by the presence and distribution of the pigments, and has the advantages over immunofluorescence. In the immunoenzyme method, the reaction can be observed with the electron microscope, which we can detect very small and higher magnification of the reaction, and it is easy to observe and high detection rate, and the samples can be stored longer than the samples of the immunofluorescence. Now I would like to talk a little more about the additional topics of electron microscopy and immunoelectron microscopy. And the electron microscopy allows the visualization of the ultrastructural details of the tissues by using the electron beams instead of using visible light. So the electron microscopy and immunoelectron microscopy achieves the magnifications of 1000 times or greater than the immunofluorescence, and therefore they can be used to observe the fine intercellular and intercellular structures such as Barber granules in the Langerhans cells, and the transmission electron microscopy achieves thermal magnification 500,000 times, and the immunomicroscopy, electron microscopy, is make use of the combination of the immunostaining and electron microscopy examination, observation, and the identify the autoantigen in the autoimmune blistering disease. In the bullous pemphigoid, BP180 antibody can be detected in the basement membrane zone, which is seen in the figure A. Is a BP180 is a transmembrane protein in the basement membrane zone, and it can be detected in the basal membrane. And BP230, which is a component of the hemidesmal zone, is inside the basement membrane zone. Thank you for your attention. If you like this video, please hit the like button and subscribe to the Burma Dermatology YouTube channel and Facebook page. Thank you.